Good day, everyone. I am Fritzie Sevilla, Teacher 3 at Muzon Elementary School. Today, I would like to present my teacher-led action research study entitled Effectiveness of Online Remediation Through Digital-Based Instructions in Enhancing the Reading Performance of Grade 3 Pupils of Muzon Elementary School. The purpose of this research is to investigate the effectiveness of online remediation through digital-based instructions in enhancing the reading performance of struggling readers during the COVID-19 pandemic. Recent results of the Program for International Student Assessment, PISA, revealed that 80% of Filipino students did not reach the minimum level of proficiency in reading. This is a concern for us, as reading is a foundational skill that is critical to academic success. Moreover, out of 90 grade pupils of Muzon Elementary School, 30 of them were identified as struggling readers, which further highlights the need of intervention to improve their reading skills. The COVID-19 pandemic has dramatically changed the educational landscape, with many students being forced to transition to remote learning. This has brought about new challenges in teaching, including the difficulty of providing adequate and effective remediation for struggling readers. In response to this challenge, the Department of Education launched the Sulong Edukalidad program, which aims to improve the quality of education in the country. As part of this initiative, the use of online remediation through digital-based instruction has been identified as a potential solution to help the struggling readers improve their reading skills even during remote learning. The innovation, intervention, and strategy of this research study. First, we conducted a pre-assessment of the pupils using the Philippine Informal Reading Inventory, or PhilIRI, graded passage. This allowed us to identify the struggling readers and their specific reading levels. Next, we conducted a virtual orientation with school staff to provide them with an overview of the intervention program. This ensured that they understood the purpose and objectives of the program, and they were able to provide the necessary support for the pupils. We created digital-based reading materials that were aligned with the pupils' reading levels. These materials included a variety of engaging texts that were designed to enhance their reading skills. We also conducted a virtual orientation with the parents and struggling readers to provide them with an overview of the program, as well as to set expectation for the intervention. This allowed us to establish open communication with the parents, pupils, and throughout the duration of the program. To ensure that the program was tailored to the pupils' specific needs, we formed two groups of struggling readers, print-based and digital-based. This allowed us to use different methods and materials to cater to different learning styles and preferences of the pupils. We then commenced the online remediation class, which consisted of digital-based instructions and activities that were designed to enhance the pupils' reading skills. The program was conducted for 6 months, and the pupils attended the class at least 6 times in a week for 1 hour per session. We monitored the implementation of the program to ensure that pupils were actively engaged and making progress in their reading skills, and we also provided regular feedback to the pupils and parents to keep them motivated and encouraged. Finally, we conducted a post-test using the PhilIRI assessment tool, which consisted of virtual one-to-one session with the pupils. We used slides, presentation of passages from PhilIRI to assess the pupils' reading skills, and the assessment tool allowed us to measure the effectiveness of the program. To achieve the goal of this action research study, the following research questions guided the teacher-researcher. 1. What is the reading readiness level of the pupils prior to the conduct of remediation in reading? First, for experimental group, and second, for the control group. Number 2, what is the reading readiness level of the pupils after the conduct of remediation in reading? First, for the experimental group, and second, for the control group. Number 3, what is the reading performance level of the respondents in digital-based instructional materials as compared to traditional printed-based instructional materials after the conduct of the online remediation in reading? And number 4, how significant are these differences in the reading readiness level in the post-test of the experimental and the control group after the conduct of the intervention program? For this study, the teacher-researcher used the quasi-experimental research design as it involved selecting two groups of grade 3 pupils. One group that received the digital-based instructions for reading remediation, which is the experimental group, and another group that receives the traditional print-based instructional materials, which is the control group. The dependent variable, reading performance, would be measured for both groups through pre- and post-tests. Participants in the study were the struggling readers in grade 3 from two sections, Mapagbigay and Mahinahon of Muzon Elementary School, composed of two groups, with a total of 24 struggling readers. During the school year 2021 and 2022, respondents were seen identified as non-readers and struggling readers because they could not pronounce and read any words from the passage shown to them, taken from the Bill Erie assessment. In a nutshell, this is how I gathered data for my action research study. First and foremost, it was important to follow an ethical procedure. This meant obtaining permission from the division office, principal, and parents before proceeding with the study. This was to ensure that all parties involved were aware of the study and that their consent was obtained before any data was collected. Next, I furnished copies of the validated instrument to participants involved in the study. This instrument was used to measure the reading performance of the grade 3 pupils before and after the implementation of the reading intervention. We then conducted a pretest to establish a baseline for the reading performance of the participants. Once the research instrument was accomplished, I retrieved it from the participants. We then conducted a post-test to measure the reading performance of the participants after the intervention had ended. Finally, the data gathered from the pre- and post-tests were tabulated and interpreted. This allowed us to assess the effectiveness of the online reading remediation in enhancing the reading performance of the grade 3 pupils. The data from the pre-test and post-test were treated using the following statistical treatment. I used percentage distribution to show the reading readiness level of the students before and after the conduct of the intervention. This method allowed me to compare the results of the pre-test and post-test and to see the improvement in the reading readiness of the students after the intervention. Next, I used t-test to test the significance of difference between the post-test and the experimental and control group mean scores. This statistical method allowed me to determine if there was a significant difference in the reading performance of the experimental and control groups after the intervention. Lastly, I used the Bill Erie table criteria in oral reading and interpretation. This table provided me with the criteria for the assessing of the oral reading fluency and comprehension of the grade 3 pupils. The research results and findings of the study, pre-test results shows that 5 of the experimental group were non-readers. They obtained 0% in their comprehension and a very low percentage of 40% to 58% in their word recognition. Additionally, 7 out of 12 respondents were categorized under frustration. They scored 40% to 60% comprehension and between 25% to 57% in the word recognition. As you can see from the results, the majority of the students were having difficulty in reading comprehension and word recognition, particularly the non-readers and those under the frustration category. The next table shows the results of the post-test among the experimental group. 2 of the respondents were still categorized as frustration, but their word recognitions improved, ranging from 78% to 85%. Unfortunately, they only obtained 20% in their comprehension. On the other hand, 9 independent respondents significantly improved their word recognition, ranging from 89% to 95%, and their comprehension improved to 80%. Meanwhile, the pre-test result shows that out of 12 respondents from the control group, 6 of them were non-readers who scored 0% in comprehension and between 37% to 43% in word recognition, indicating a very poor percentage in recognizing words. The other 6 respondents fell under the frustration level, with a comprehension scores of 40% and word recognition scores ranging from 50% to 65%. These results suggest that non-readers need to focus on improving their word recognition skills, while those in the frustration level may benefit from improving their comprehension skills. The post-test results shows that out of 12 respondents in the control group, 7 were classified as frustrated readers with word recognition scores ranging from 55% to 68%, and comprehension scores ranging from 40% to 60%. 3 respondents were classified as instructional readers with word recognition scores of 90% and comprehension scores of 80%. The remaining 2 respondents were still classified as non-readers. The results indicate a minimal increase in the reading readiness level of the children who underwent the traditional printed-based instructional materials. However, some learners still belong to the frustration level, and a few of them remained non-readers even after the intervention. This table contains the computed frequency and percentage during the conduct of the post-test. This shows that 9 or 75% of the pupils were classified as independent readers, 1 or 8% as instructional, and 2 or 17% frustrated readers. In contrast, the use of printed materials guided by the home facilitator resulted in the minimal improvement in pupils' reading ability. 8 or 25% respondents were classified as instructional readers, 7 or 58% as frustrated readers, and 2 or 17% as non-readers, even after the intervention. The results clearly demonstrate the superiority of digital-based instructional materials over printed-based materials in improving the reading performance of the grade 3 pupils. The significant improvement observed in pupils' reading ability through the use of digital-based instructions highlights the potential of technology in enhancing the effectiveness of reading interventions. On the other hand, the t-test results revealed a computed value of 4.01, which is significantly greater than the critical value of 1.69. This indicates that there is a significant difference in the post-test mean score of learners after the implementation of the intervention, with the experimental group performing better than the control group. Based on the post-test results, it is evident that the use of digitized instructional materials has led to a higher level of performance in the experimental group compared to the control group. This difference is considered statistically significant, and it confirms that the intervention was effective in improving the learner's performance. Therefore, the results of t-test provide strong evidence that the use of digitized instructional materials has had a positive impact on the learner's performance, and it is a viable approach for enhancing the quality of education. Based on the findings of our research on the effectiveness of online reading remediation through digital-based instructions, we recommend the following action plans to enhance the reading performance of grade 3 pupils. We believe that the action plans we have proposed can help improve the teaching and learning process in our schools, and we are committed to implementing these plans with the support of our stakeholders. Thank you once again for your time and attention. We appreciate your interest in our study, and we hope that the results will contribute to the ongoing efforts to improve the quality of education for our students.